This is VITALS, Visionary Health Leadership in Action.
Welcome, everyone, and thank you so much for tuning into Neomed's VITALS podcast. If you're new here, VITALS stands for Value-Based Innovation, Technology, Advocacy, Leadership, and Service. Neomed's VITALS is a monthly health leadership series in collaboration with university hospitals. It is an open forum to discuss our nation's biggest healthcare problems and to hear from leaders who are using the VITALS tools to solve these problems at a local and national level. This episode will feature Dr. Kendalle Cobb in a critical topic within healthcare, health equity. To give you a little background, Dr. Cobb serves as a clinical associate professor at the Cleveland Clinic Lerner College of Medicine.
I'm hoping that over the next few minutes, you'll be able to understand what health equity is, to identify steps to achieve health equity, and to recognize that we each create the culture of an organization to ensure health equity. I want to share with you what's going on here in Cleveland and Northeast Ohio. Right around the hospital, life expectancy is 23 years shorter than it is just 4 miles away. That's huge, and there's something that we can do about it.
There are many factors that influence a population's health, such as access to good education, nutritious food, safe housing, reliable public transportation, health insurance, clean water and air, and healthcare providers who understand and respect their culture. So what exactly is health equity, and what can be done to increase efforts towards it?
Health equity means that everyone has a fair and just opportunity to achieve health. Our ideal state at the Cleveland Clinic for patient care is to have culturally aligned, equitable, and inclusive care. I want to share with you a little bit about what the American Hospital Association says that any organization can do to journey towards health equity, and then share with you a few of the things that we're doing here at Cleveland Clinic. The first is culturally appropriate health care. I'm going to mention the 6, and then I'll go a little bit into each of them. Equitable and inclusive organizational policies, collection and use of data to drive action, diverse representation in leadership and governance, community collaboration for solutions, and lastly, systemic and shared accountability. So there are a few things that are important. One can imagine that if you have a patient that is very different than you are, has had different life expectancies, different life experiences, you might think that you can just treat them how you treat everybody. There's something called the platinum rule, which is to treat others as they wish to be treated. And so you have to modify your approach to patients based on what their needs are.
In essence, health equity is a holistic endeavor, acknowledging and dismantling barriers that prevent individuals and communities from attaining their highest level of health. It's about creating a society where everyone has the opportunity to thrive, regardless of their background or circumstances. There are many key elements to consider when it comes to patient care, like cultural competence, communication styles, addressing socioeconomic factors, customized treatment plans, and awareness of implicit bias. All of these things impact health equity, and they play a major role in establishing trust and a healthy doctor-patient relationship.
I've recently had patients who had avoided getting health care for decades because of how they were treated when they went to the doctor's office. These are patients that struggle with obesity, and they felt shamed and not treated with respect.
I'm sure what Dr. Cobb shared is relatable and true to many people, and it adds more reason to why everyone deserves health equity, to be seen, heard, respected, and understood by their healthcare team.
It's also important to be aware, as we're taking care of people from different backgrounds, if they have certain religious beliefs or are observing a practice that would be something that would affect their care. For example, if a patient were hospitalized and they were Muslim and it was during Ramadan, it would be important to know that they're fasting during daylight hours. And so part of what is important is to make sure that we're aware of the differences and honoring the differences between people. The next step is policies and the impact. So one of the things that we focused on in the last 2 years here at Cleveland Clinic is really looking at policies, not from like what they were initially intended for, but what is the impact and the outcomes of our institutional policies? For example, I was learning earlier today about someone who had been hired for environmental services. We used to have a rule that someone has to be in their position for a year before they can apply for a transition. Well, then they found out that this was somebody that had majored in chemistry who was planning on applying to nursing school. And so through a series of conversations, they were able to move him to be a nurse's aide, which was much more fulfilling for him. So we have to make sure that we recognize how policies can adversely affect people and not be so focused on policy that we neglect enhancing and nurturing people to their full potential. Another thing that we focused on in recent years is switching from a list of certain criteria that have to do with graduation requirements and that kind of thing, and really focusing more on skilled-based assessments and hiring, and also creating career paths for people. So if they enter at one level, they have a trajectory of moves that they can make within the organization.
Our bodies are complex, and factors like genetics, lifestyle, environment, and even cultural background play a significant role in shaping our health. It's like trying to fit everyone in the same pair of shoes. It just doesn't work. We live in a world that loves quick fixes and universal solutions, but when it comes to health, and especially health equity, it's about finding what truly works for the patient. This doesn't mean disregarding scientific principles. Rather, it's about tailoring those principles to fit your patient's individual needs.
The thing that I'm most passionate about is the work that I've been engaged with in the past year, which is helping the organization to develop a health disparity measurement. Cleveland Clinic is a world-renowned organization. One of our motto is that every life deserves world-class care. But we know that unless you look at outcomes, unless you measure something, you're not going to be able to move it. And so in addition to overall outcomes, one of the things that we're looking at is all of the different factors of a person that can impact their health. And so some of those things are race, ethnicity, language, sexual orientation, gender identity, but it can also be things like disability or military status, social determinants of health, area deprivation index, and immigration status. And so we're looking at how we perform as far as outcomes and experiences based on how patients identify. Part of that also has to do with making sure that we have the information from patients. So that means helping patients to understand why we're asking the questions, but also giving employees, what we call caregivers here, the language to sensitively and respectfully ask patients about how they identify, and making sure that the right member of the team is asking the question. One can imagine that you don't necessarily want somebody asking at the front desk what somebody's sexual orientation is. That might not be the right member of the team to ask that question. The next thing is diversity and diverse representation in leadership and governance. So 9% of our clinical institute chiefs are women. That is in spite of the fact that 40% of the doctors that work at Cleveland Clinic are women. So we have a ways to go with that. But we also have 27.3% of our institute chiefs. So these are the senior leaders of our clinical areas that are underrepresented minorities. As far as the people that directly report to the president and CEO, that's called the executive team, 35.7% are women and 14.3% are underrepresented in medicine. The next step that's important in achieving and journeying towards health equity is community collaborations for solutions. That is recognizing that the people with the lived experience have the expertise to know what is going to be most helpful to them. We have a few of those. Langston Hughes is an area resource center that now has a gym where we have exercise physiologists to give feedback to people. And it's a safe place where members of the community, regardless of whether they get their care at Cleveland Clinic, can go and exercise and have a safe place to be fit. El Centro is an area on the west side that we've partnered with to provide care to patients who primarily speak Spanish. We're engaging more with community health workers, that is, people from the community who are trusted and well-known to help patients achieve their health goals. There's something called Unite Us. So we ask about social determinants of health, asking if people have transportation issues, housing issues, but then what do we do with that? And so there's a platform called Unite Us that we enter that information into. And then that organization, which is used by other healthcare systems in the city is able to connect patients with community resources and to track whether or not they actually followed up with that. We also automatically do referrals to social workers in those cases, or if somebody is having an issue with intimate partner violence, escalating that to protective services, which is our police force. And then a huge problem in the United States, and specifically in Northeast Ohio, is infant and maternal mortality that is disparate based on race. And so we partner with Birthing Beautiful Communities, which is an organization that has doulas that accompany patients to their appointments to advocate for them. And lastly, systemic and shared accountability is key. That is, everyone is welcome here, but not all behavior is welcome here. And making sure that we have a just culture. That is, are we having reasonable expectations? Do we help people to correct their behavior if they have a problem? But also that we have certain standards that people should adhere to keep patients and other caregivers safe. And we are moving towards being a high reliability organization. That it means speaking up if you see something wrong, doing something if you see something, doing something and saying something if you see something. And so lastly, I just want to say that acting on that principle of everyone deserves world-class care is something that is essential to becoming a health equity home for everybody. That is that we can't just act like, oh, people are lucky to be here. People choose to entrust us with their care. People choose to work here. And so really valuing that choice, honoring that choice, and expressing appreciation. Speaking up when we see something that isn't right. If we see somebody that hasn't been treated well, if we see something that is going to adversely affect them or their health, saying something. And then lastly, recognizing that we don't know other people's journey. And so it's important to approach patients and each other with humility and also with respect.
Thank you again to everyone who tuned in to this episode of VITALS podcast on health equity. Be sure to check out Neomed's YouTube channel to see the full 1-hour VITALS presentation with Dr. Cobb, including the audience Q&A, which is moderated by Monica Robbins, Senior Health Correspondent at WKYC in Cleveland. Until next time.
This is VITALS, Visionary Health Leadership in Action.